Okay, hi class. Today we're going to be discussing some viral diseases in humans, everything from AIDS to zoster. Okay, so after reading this chapter, you should be able to identify and describe several viral diseases of the skin, draw the structure of the type A virus, and compare and contrast symptoms with common cold symptoms, identify three viral diseases of the nervous system and explain why they are so dangerous, uh, listing and describing several diseases of the visceral organs, including the blood, liver, and the gastrointestinal tract. Finally, compare and contrasting HIV infection and AIDS. Okay, so influenza. Um, most of the influenza we see is seasonal. That is, you really only get it in certain times of the year, and that mainly has to do when the causative agent is around and factors like staying inside more, where you might recycle air from person to person um, and actually get the virus and ingest it to breathe it in. Okay. Occasionally we have epidemics, um, and when it goes worldwide, then it's a pandemic, and those pandemics are fairly rare, but there was one in 2009, and when that happens, when it's a pandemic, that means again it's a worldwide outbreak, and so it's epidemic levels, but worldwide. Viral disease of the skin. Okay. Herpes simplex. So herpes simplex virus type 1 usually reflects the facial area around the lips. Um, these are the your kind of cold sores or things called fever blisters. Um, and again, the uh, sort of rare form of herpes simplex 1 is that you're going to get cold sores. Now, herpes simplex type 2 is responsible as an STD. So those were where you'll get the genital herpes. Okay, so those are around the mouth for cold sores. Now, chickenpox, um, caused by the varicella zoster virus, and represents the primary site of infection. Um, you'll get the pox um, generally over most of the body. Um, you'll see in that picture there um, the pox are breaking out on that person's back. Okay, and one of the things about shingles and chickenpox is that the virus will remain uh, in a latency state in the roots of the nerve cells. And when we're saying latency, what that means is that they're infected, but there are no outward or no outward appearance of the disease. So you can have the disease present in the roots, in the nerve roots, but won't be active. You won't be actively making the pox. Okay. Um, so shingles, um, you get these shingles on the um, on your skin, um, and these are uh, re reemergence of the chickenpox virus. Okay, there are some vaccines available to get rid of shingles, and shingles is generally a disease of older people, and so if you can get the disease while you're younger, you can keep the shingles from happening. Measles or rubella, um, caused by an RNA virus transmitted by respiratory droplets. Uh, and nowadays, because most people in the US are vaccinated with the MMR vaccine, it's very rarely seen in the United States. So when you have the measles, you'll have a hacking cough, sneezing, nasal congestion, eye redness, sensitivity to light, and a high fever. Um, when you have measles, you'll also have a full body rash. And like I said, in the United States, we don't have much measles because almost everyone is vaccinated for it. And so in this country, you get that highly effective vaccine so that you don't get the measles. Rubella or German measles is rubella is different from measles. You get a slightly red rash, and is caused by the rubella virus, not the measles virus. You can occasionally get a fever, a variable pale pink rash that is almost always going to begin on the face and then spread to the trunk and the extremities. And again, we have a very, very good vaccine for this. So again, the MMR uh, vaccine that everyone is required to have um, will prevent you from getting rubella. Uh, if a child gets a congenital rubella, can be very dangerous to the fetus. Okay. Mumps, caused by a different RNA virus, and is characteristic of having uh, enlarged um, salivary glands, um, and can definitely be um, very, very painful because of swelling. Again, the MMR vaccine is going to help you get or keep you from getting mumps. Fifth disease. Fifth disease is caused by a DNA virus, and we starts off by a rash, and is most common in children. And like it says, you get a mild rash on the cheeks and the ears, and there are no known treatments for Fifth disease. Smallpox, caused by another DNA virus. Um, Now, one of the nice things about smallpox is there was a movement to do a worldwide vaccination, and while it took years to get the entire world vaccinated, um, they have identified a person who is the last known case of smallpox. Um, the vaccination was very complete, and the virus is now eradicated. The only place that the virus actually exists, there's some at the Centers of Disease Control in Washington, and there's some in a laboratory in Russia. But that's the only known smallpox that exists. Okay, so your symptoms, if you were to get smallpox, um, these small red spots, and as you see in that picture, um, they become fluid filled, and they're little fluid filled pustules. Okay, um, and if someone was to break open one of those spots, then those pustules would contain a whole lot of infectious particles and be able to spread the disease. So that's part of the reason it was so dangerous. Is it was pretty easy to have a lot of the virus around because those pustules would break open. Um, it is extremely lethal, and if you do survive, you mostly will leave your skin very pitted and scarred, leaving the pox, hence smallpox. Um, and there are, well, not officially our government, but um, there are governments um, who will claim to have been developing smallpox as a bioterrorism agent. And again, our country doesn't officially do it, but you can probably bet that we do. Okay. Um, to go from that very extreme um, to just warts, okay? Um, and warts are caused by different forms of human papillomavirus, um, and that is a DNA virus. Okay. And there are many types of warts, um, skin and plantar's warts, genital warts. Um, Now, there are vaccines um, mostly used for the genital warts, um, and one of the reasons why you'd want to prevent the HPV from um, causing the genital warts is that that is a good source of cervical cancer or penile cancer. So if you can ward off those warts, you're going to hopefully ward off those cancers. Okay, viral disease of the respiratory tract, flus and colds. Influenza, caused by the influenza virus A, and, B, and C. and all the influenza viruses are RNA viruses. Uh, Type A is responsible for outbreaks, epidemics, and is the most pandemic. Um, Signs and symptoms: sudden chills, fatigue, headache, pain that is most pronounced in the chest, back, and the legs, high fever, and a severe cough. Now, this shows us the structure of the influenza virus, um, and there are two spikes on the influenza virus. You have the N spikes and the H spikes. So the H spikes are hemagglutinin, and um, the N spikes are neuraminidase. And so those are two enzymes that stick out from the surface of the virus particle. Okay. Um, Now, there are some flu antivirals like Tamiflu, um, and there are also vaccines. Um, you can either get an inactivated or an attenuated, um, and those vaccines are definitely probably worth it. Um, I have no idea which one is actually better, but remember that when it is flu season, that you can get a influenza shot to try to prevent getting the disease. Now, avian or bird flu is a new variant, and it is spread through bird migration fowl or wild uh, birds, um, and there is really no human-to-human transmission. So while it is a problem among birds, and if you were to get the avian flu, um, you would not be able to spread it to another person. Now, some northern diseases, um, severe acute respiratory syndrome or SARS. Um, the SARS outbreak uh, first occurred in 2003 and was primarily in southeastern China and Southeast Asia. Um, and this is an example of a newly emerging disease. Um, the signs and symptoms: high fever, headache, body aches and discomfort, um, and definitely is spread person to person, and so you can uh, lower your chance of getting it by not being in contact with a lot of people. Um, MERS, or Middle Eastern Respiratory Syndrome, um, is a virus very similar to the SARS virus and is primarily in the Middle East, especially in Saudi Arabia. Respiratory syncytial um, is caused by a respiratory syncytial virus, um, which is an RNA virus. It affects infants and children less than 2 years old, and there is an antiviral treatment, uh, riboflavin, uh, is the antiviral that can treat that. Uh, so a sort of run-of-the-mill cold um, would be from the rhinovirus family, and one of the things that is kind of interesting, We know that the rhinovirus is important here, but there are sort of a big mixture of rhinoviruses. There are many different kinds of rhinoviruses. Okay. And like it says, there are about 100 different subtypes of the rhinovirus. And that's part of the reason why you can get a cold uh, multiple times, because you might be infected by one virus and get one cold and then get one of the other 99 other viruses and you can get a cold again. Okay. Um, Now on that chart shows you the months that the different diseases predominate, are most prominent, um, and you can see that things like respiratory diseases, like a cold, um, are going to have certain times of the year when they're most common. So for a cold, you'll have a headache, dry, scratchy throat, runny nose, variable cough, and little to no fever. Okay. Um, Probably, again, in most colds, uh, the runny nose um, and some coughing are probably the two most mm, prominent things that people get. Um, and again, little to no fever for a common cold. Okay. Um, because there's so many different viruses, there are no vaccines or antiviral drugs because you don't even really know which exact virus you're uh, looking at when you have a head cold. Okay, and it's probably worth looking at that section, the 18.3, to look at the differences between colds and flus in terms of their symptoms. Okay, viral disease of the nervous system, and here again, these can be some very life-threatening diseases. Okay, first disease is rabies. Rabies is caused by an RNA virus, and both domestic and wild animals can be carriers. Um, Dogs and cats are not that big of a problem in this country, but certainly things like raccoons, squirrels, skunks, and bats um, are again, highly infected. Um, these, when the animal gets rabies, can be fatal to the animal, um, and that includes humans. Um, and the transmission is from an infected animal uh, to a person or to another animal through a skin wound, um, saliva, and body and other body fluids are the most affected with the virus. And the incubation period can be from several days to up to a year. Um, there are vaccines available and routine for dogs, which is one of the reasons why we just don't have that problem in this country. Okay, signs and symptoms of rabies. Um, abnormal sensation to the site of the bite from the infected animal, a lot of tingling, burning, and increased muscle tensions. Um, and individuals can become alert and aggressive, and paralysis, especially in the swallowing muscles, can occur. And saliva droplets from mouth um, and frothing of the mouth is a pretty good indication that someone might have rabies. Um, and you have hydrophobia, which means that you are afraid of water, and so you don't want to drink anything. And death usually occurs from respiratory paralysis. Okay. Um, Now, you want to, of course, avoid the animals that might be infected, but you can also uh, use a vaccine to try to prevent the rabies from occurring. Polio, again caused by an RNA virus, um, can cause paralysis. Uh, you can get it from contaminated drinking water or foods, and you might have seen old photos of drinking fountains being off limits because someone around the area had gotten polio, and to reduce the spread, they would just shut off public water fountains. Um, we have very good vaccines for this, um, and the first person to develop one of these vaccines was Salk, and he used an inactivated virus. And Sabian uses an attenuated virus, so it's a virus, but it's changed in some way that makes it non-infectious. Um, there is a global eradication effort, and we are really in sort of the last stages of that. Um, Polio will probably become uh, not a disease anymore um, at some point in the future. Um, West Nile virus infection caused by another RNA virus and is transmitted by infected mosquitoes. And so you can see the transmission cycle that mosquito will have taken a blood meal from, say, a horse, and then it can go into a bird, crow in this case, um, and that bird becomes the primary reservoir, and so the virus is going to uh, reproduce and make more copies of the virus in the bird, but isn't causing disease uh, in the bird. And then from the bird, another mosquito can take a blood meal from uh, the crow and then go on to infect humans or a horse. Okay, symptoms of West Nile, um, and are well, there are very few symptoms um, that are very unique to West Nile, um, and 20% exhibit illness and recovery. Okay. 1% can have a cephalitis or meningitis, which means that the brain swells, or yeah. So it's West Nile. It's a pretty low prevalence of having the brain swelling, and there are no vaccines or antiviral drugs available for West Nile. So viral disease of visceral organs. Yellow fever caused by still another RNA virus, and it's transmitted by the bite of an infected mosquito. Can cause liver damage, which leads to jaundice or another a yellowing of the skin. Signs and symptoms of yellow fever: bleeding of the gums, bloody stools and vomit, delirium, death caused by eruption of the capillaries, so you have a lot of internal bleeding, and from yellow fever you have a very high mortality rate. So a lot of people die from yellow fever. Now there are some vaccines available and are only given to people who are going to areas where the yellow fever is endemic. Um, if you're not in one of those high risk groups, you probably will never get the vaccine. Dengue fever, um, caused by still another RNA virus, and again transmitted by a bite from an infected mosquito. Signs and symptoms of dengue fever: a very high fever, uh, severe procrastination, uh, lower pains, sharp pains in muscles and joints, and the infection is usually not fatal. Okay, so here you can have the high fever, but it won't kill you. Uh, in subsequent infections, um, are potentially fatal dengue hemorrhagic fever. Um, so in a hemorrhagic fever, you'd be doing a lot of internal bleeding. Infectious mononucleosis, um, or most people just call it mono. This case is a DNA virus. Uh, it the virus is actually a form of Epstein-Barr virus. Okay. Um, it's one of the forms that is similar to herpes virus. Your signs and symptoms: sore throat, fever, enlarged spleen. Uh, the virus can lay in latency within the body, and then it can be reactivated. Um, and we don't know exactly what the reactivation cycle is. I know someone who was studying this, and it could be, well, he hasn't proved it yet, but in laboratory animals, uh, something like a hot tub could actually be the key to reactivating that virus as it lays dormant. Um, Burkitt's lymphoma can also be caused. Hepatitis. um, are caused by different viruses, and they can either be DNA or RNA viruses. Signs and symptoms: um, anorexia, nausea, vomiting, low-grade fever. Uh, and hepatitis A is transmitted by food and water. There are vaccines to hepatitis A. Hepatitis B, caused by a DNA virus, and is transmitted by infected blood or other bodily fluids. Uh, and there is an extremely effective vaccine against hepatitis B. Um, so probably someone who would say uh, work in a hospital, so they would come in contact with patients' blood. They would probably get that vaccine so that they wouldn't get the hepatitis B. Okay, hepatitis C is caused by an RNA virus and is transmitted uh, by infected blood or other bodily fluids. So similar to hepatitis B, um, and yeah, you can see the chart. The percent of uh, transmission from different sources. You can see that uh, injected drug use is the majority of the cases of Hep C. Viral gastroenteritis caused by an RNA virus, so either a rotavirus or a norovirus. Signs and symptoms: diarrhea, nausea, vomiting, low-grade fever, cramping, headache, and general malaise. You just don't feel good, sort of all over. Uh, hemorrhagic fever. All the hemorrhagic fevers are caused by RNA viruses. Um, and we can have different diseases caused by different viruses. Ebola and Marburg are very potent bleeding diseases, and if you have Ebola or Marburg, you basically get the disease, get the virus, and you literally bleed to death. Uh, in general, you're going to have a lot of fatigue, fever, diarrhea, weakness, dizziness, and muscle aches. And the Ebola or Marburg are going to cause a major hemorrhaging. And so, like I said, you bleed to death when you have one of these viruses. Okay, HIV and AIDS. And we can call this a modern day plague. And in fact, most of you probably um, have had or HIV and AIDS has been a thing since you've been alive. Um, Luckily, I was born really before there was uh, HIV infections. Um, so uh, these are retroviruses, um, meaning that the virus is a RNA which turns into DNA, which then gets incorporated into the cells of the host, in this case humans. And like I said, it was first recognized in 1981. And so as I think about that, that's my first year of high school. Um, so uh, you're, or as you develop within the disease, you can get AIDS, which is an acquired immunodeficiency syndrome, and you're going to get a loss of immunity, okay, especially cell-mediated immunity, and the main cells that are involved in it are the helper T cells. And again, you can pretty much imagine once you start losing big parts of your immune system, you're going to have real problems. Okay, so let's look at this real quick. Uh, so in the virus has an enzyme called reverse transcriptase, and that is an enzyme which can take the RNA and turn it into a DNA. Okay, so there's a single copy of the RNA in the virus particle, and then that's reverse transcribed into DNA. Um, and over on the figure, we can look at this. Okay, so the first thing that's going to happen is you're going to have attachment and entry of the virus into the human cell, and then uh, the double-stranded RNA will get integrated into the chromosome and is known as a protovirus. Okay, so on panel B there, we see that the RNA is reverse transcribed and forms that protovirus. Then once that is incorporated into the genome, then that that DNA will make more copies of the RNA from it, and that's the biosynthesis of the virus, DNA, RNA, and finally the host cell will assemble and release the virus back into the bloodstream. So when you have an HIV infection, you're going to lose parts of your immune system. And what happens, and what's very characteristic, is that you get opportunistic infections. So infections that wouldn't occur very commonly if you have a healthy immune system, but when you don't have a good immune system, uh, these uh, these come up. Um, so one of the ways of testing for HIV is the presence of anti-HIV antibodies. This has to be done by a Western blot, um, which is sort of a standard laboratory procedure um, where you're looking for a protein, which an antibody is, um, by a very specific uh, type of other protein that will interact with it. Um, so as of now, we have no cures yet for AIDS. um, and you can sort of prolong how long you're going to survive with antiviral drugs to keep the virus level in control. Um, Mostly, uh, these antiviral drugs are going to stop the penetration and uncoating of the virus. And we also have some drugs that are reverse transcriptase inhibitors. We also have integrase inhibitors, so keeping the new DNA from actually getting into the DNA of the host cell. And we can also have protease inhibitors, so we can have certain proteins that are inhibited so that you can't get a fully assembled virus because you're going to need some protein to be able to make a full virus particle. Okay, so what should you have taken from this lecture? Types of diseases and viruses responsible for human skin diseases, characteristics of cold and flu viruses, viral diseases affecting the nervous system, viruses responsible for the visceral organs, infectious processing of HIV disease. Um, so, uh, as a big thought question, uh, using the viral disease in this chapter, describe the 5 stages of virus replication that is used by each type of virus. So remember, it's going to be very different, a DNA virus from an RNA virus. All right, thank you.